Your organisation, International AIDS Alliance, is worried that health in general and HIV/AIDS in particular will slip off the list of 2015 MDG objectives. Why?
Yes, International HIV/AIDS Alliance, which is a global partnership of national and community-based organizations which are empowering communities to tackle HIV/AIDS and health, really believes that it's important that in the new framework the health goals are not weaker than in the current framework. I must say that in the Millennium Development Goals framework there have been 3 health MDGs, and we have been really privileged from that perspective. It has really helped to improve the lives of children, of mothers, make treatment much more accessible to people living with HIV/AIDS. So there has been a lot of space for progress which has been made. In the new framework, we are worried that health might lose its positions because the agenda is more challenging and more complicated. The whole sustainable development agenda, the climate change agenda. We believe that health should be maintained and should not be weaker, particularly on the areas of targets and indicators. Because the health of people is so central to economic growth and to sustainable development. Healthy people are able to work hard and deliver economic change. And there are links between health and other areas like climate change, urbanization. So we believe that health is central for sustainable development agenda, and thus health should be very prominent on the new agenda.
Who are the most powerful players in the health and development sector, and what are they arguing in this debate?
Yes, there are a lot of discussions at the moment within health sector, but also in a broader development on what should be the future of the health post-millennium development goals. Non-governmental organizations who are representing the communities are discussing what should be the agenda. Also, high-level panel is very involved. So it's those who are participating in the current consultation processes who are discussing different options. And although we are discussing a lot inside the sector, what is important is that we also communicate our messages to broader development partners, those working on climate change, also in other areas like private sector trade, so that we find the joint synergies of work. Because one of the challenges in the previous framework was that goals have been working in silos. So what's important is that we find more synergies between different areas. So what's currently the discussion is for health is that there are 3 main trends of discussion. The first one is how do we make sure that unmet Millennium Development Goals are not dropped, but they continued being delivered. So, for example, for HIV/AIDS, for child and for child health and maternal health, how do we make sure that governments continue being committed to delivering on these goals? Second discussion is how do we find a more overarching goal for health that would include different areas in a more comprehensive way?
This is public health coverage versus a focus on particular diseases or particular issues, isn't it?
Yes, or I would say it's more health outcome focus versus more health systems focus. So the one of the potential solutions for health systems focus goal is universal health coverage. So how do we empower the systems to deliver on different health problems for all? How do we make sure that people are not suffering from financial hardships when they're trying to access healthcare services? And the life outcomes, overarching goal discussions are around life expectancy or quality of life. So life expectancy is also a very strong candidate. And the third trend of discussions is how do we make sure that we enable the synergies between health and broader issues such as climate change, and also very importantly the social determinants of health such as income, sanitation. How do we make sure that health and other social determinants of health are comprehensively linked?
And how will the new MDGs be funded in this time of economic recession?
Yes, funding of a new, potentially more ambitious development agenda is really important. I believe that no framework should be created without concrete funding plans, and none of the new goals should be left unfunded. Otherwise, it would be just the declarations. So the official development assistance, which is currently the main financial resource for financing development, is very relevant and would remain to be extremely important. And what's important is that rich countries continue to deliver on their commitments on aid. It's important that governments commit to 0.7 of GNI going to development. So this source of financing is important. Second source is what we're seeing is that a lot of middle-income countries are becoming donors themselves. So it's important for international community to encourage that efforts and make sure that governments pay much more for development.
This is countries like Brazil and India and China.
Yes, exactly. And so how do we make sure that they pay much more for development, but also how do they finance the national development responses in a way that the funding goes to the poorest people? Because it's quite clear that they have more resources and the governments give more funding, but the question is how do we make sure that most vulnerable, such as people who use drugs, people living with HIV/AIDS, have access to those resources. But also there is a lot of new developments around the innovative sources of financing for development, and one option which is currently on the table and the details are currently being finalized by the European governments. It's a financial transaction tax. It's a small tax on the financial transactions, which would be able to generate significant amounts of money for domestic and international development. Currently, 11 European countries have committed to implementing the financial transaction tax. And currently the discussions in European Commission and European Parliament is how to take it forward. So we're very excited that a significant portion of this tax would go to development. However, the battle is not won yet because there is a risk that in the current economic hardships, the income from financial transaction tax could go to bailing out banks, which we definitely oppose. We believe that poorest should benefit from financial transaction tax the most. And financial transaction tax is a very sustainable way of financing development because the financial transactions happen and it's important that the richest contribute to addressing the problems of the poorest.